What you see behind me is the Headache on the Hill flag installation. Tens of thousands of flags, one flag representing over 1,500 people living with the over 200 different types of headache disorders. Every flag is a story, a fight for dignity, treatment, and understanding. This installation is for Heidi in California, whose migraine disease ended her career as a teacher. It's for Joe in New Jersey, a 9/11 first responder who considered ending his life because of relentless cluster headache attacks. It's for Tammy in Florida, who experiences one-sided paralysis during hemiplegic migraine attacks and keeps medication in every room of her house in case she can't make it to another. It's for Joey in Nevada, a musician living with new daily persistent headache, pain every single day, all day long, with no FDA-approved treatment. It's for the trigeminal neuralgia patient who had 3 teeth pulled before anyone realized her pain wasn't dental. It's for the spinal CSF leak patient who spends 23 hours a day lying flat because sitting up triggers unbearable pain. It's for Plagette in Texas, whose migraine disease ended her military career. It's for my son Jude, who was only 9 years old when he had his first emergency department visit for an 11-day migraine attack. It's for Danielle in Utah, who died by suicide just weeks before her 18th birthday. And it's for me and so many others who hide our pain because we don't want to be seen as less capable or lazy, because the stigma around our disease state is profound. It's for all of us, and it sends a message that we won't be ignored any longer, and we demand more. More research, more specialists, more treatment options, and more good days. Migraine is the leading cause of disability in young women. Many experience their first attack in childhood, but wait years for a diagnosis. Despite this, there are fewer than 900 certified headache specialists nationwide. Access is deeply inequitable, and far too many go untreated. That's why we're here, not just raising awareness today. We're building momentum for policy change, starting with the Headache Act, the first bill focused specifically on addressing these diseases through coordinated federal action, a national plan for migraine and headache disorders. We are so grateful to our champion, Representative Lori Trahan, for leading on this important bill, and we are calling on the rest of Congress to join us and make this a strong, united, bipartisan effort. This is our moment, our turning point. And none of this would be possible without the courageous voices of those willing to share their personal journeys, because statistics alone aren't enough to change hearts and minds. We know we have that on our side. No, it's the personal stories that make the difference. So now I am honored to introduce one of those voices and personal stories. Jamie Sanders is a fierce and compassionate advocate from Virginia who lives with migraine. She's here to speak not just for herself, but for so many who live with these diseases and have never been heard. Please join me in welcoming Jamie.
Good morning, everyone. Thank you so much for having me and letting me share my story and my experience living with migraine disease. For most of my life, the only normalcy I knew involved chronic pain. Migraine disease has been present in my life since I was a toddler. My parents thought I had severe motion sickness, which looking back, I now know was abdominal migraine. I had my first migraine attack at 8 years old and was diagnosed by both my pediatrician and a neurologist. My mother's side of the family had a history of migraine, but I was told I'd outgrow them by the time I turned 18. They persisted, though, through my early 20s with 2 to 8 attacks per month. In 2001, I experienced my first intractable migraine during the first trimester of pregnancy. An MRI ruled out a brain tumor or any other abnormality. The migraine disappeared during my second trimester, but the attacks became more severe and frequent, requiring preventive medication. I tried and failed on many preventives and had a low tolerance to triptans and most NSAIDs, limiting my pain relief options. At just 27 years old, I graduated to chronic migraine after years of failed treatments. By 28, I had also developed chronic daily headache and new daily persistent headache. Pain was a daily constant in my life. Living with chronic migraine is like navigating a minefield, never knowing when the next explosion of pain will come. As a child, the searing headaches were misunderstood and dismissed by those around me. It's just a headache, they'd say. But it was never just a headache. It was a monster that consumed me, leaving me in a dark room isolated from the world. Migraine is a debilitating and pervasive disorder, impacting every facet of life. It is frequently misunderstood and trivialized, dismissed as merely a bad headache. This dismissal is particularly challenging for those who suffer from migraine, as they are constantly forced to validate their pain. The struggle of living with an invisible illness like migraine begins with the simple fact that others cannot see your pain. This lack of visibility can lead to misunderstanding, skepticism, and even outright disbelief. It can make you feel as though your experience is invalid or exaggerated, that the agony you endure is somehow less real because it cannot be easily observed. This invisibility extends beyond the physical symptoms of migraine to the emotional and psychological toll it takes, creating a complex web of challenges that are often minimized or ignored by others. Migraine is a debilitating neurological condition with diverse symptoms, including intense pain, nausea, vomiting, and sensitivity to light and sound. Finding effective treatment is challenging due to a lack of understanding and options, despite the condition's prevalence. One of the central goals of my advocacy work has been to push for better treatment and care for people living with migraine. This has involved advocating for more research into the condition, for greater access to effective treatments, and a more compassionate and understanding approach to care. The lack of effective treatment options for migraine is a major issue for the millions of people living with the condition. While there have been some recent advances, such as the development of CGRP inhibitors, many people still struggle to find treatments that work for them. This is compounded by the fact that migraine is often underfunded and under-researched, with far less attention and resources devoted to it than other conditions with similar prevalence. The exorbitant costs associated with migraine treatment, including medications, diagnostic tests, and consultations with specialized neurologists or headache specialists, pose substantial financial barriers for countless migraine patients. This is particularly true for individuals with limited or inadequate insurance coverage, who may be forced to choose between paying for essential migraine care and other necessary living expenses. This financial burden can lead to delayed or foregone treatment, resulting in poorer health outcomes and decreased quality of life for migraine sufferers. By improving insurance coverage and expanding financial assistance programs, we can make migraine treatment more accessible and affordable for all patients, regardless of the socioeconomic status. This will not only improve the health and well-being of migraine sufferers, but also reduce the overall economic burden of migraine on society. Navigating the challenges of living with chronic migraine requires a combination of resilience, self-advocacy, and community support. It means recognizing and challenging the stereotypes and biases that affect how we are treated, both in the healthcare system and in society at large. It also means finding ways to take care of ourselves, building a support system, and advocating for the care and treatment we deserve. I will continue to advocate for myself and others. We are more than our pain. We have dreams and passions. We are not alone. We are stronger than we think, and we can live fully despite our challenges. Thank you so much.
Jamie, thank you so much for your powerful words and vulnerability. Now I'm honored to introduce someone who sees the impact of these diseases every day in her clinic and has been a leader in advancing the field of headache medicine. Dr. Barbara Nye is a neurologist and headache specialist, as well as the vice president of the board of directors for the Alliance for Headache Disorders Advocacy. Her expertise, compassion, and tireless advocacy has been instrumental in shaping both this movement and this moment. Thank you, and please join me in welcoming Dr. Nye.
Good morning. I can't begin to express the deep emotion I feel standing before this visual representation of what so many lives live in silently, the impact of migraine and other headache disorders. As a physician who specializes in headache medicine for over a decade, I've seen firsthand the isolation my patients feel. Many arrive in my office believing they must simply endure daily headaches, unaware that there's effective treatments that effective treatment options exist. Others finally hear for the first time, you do not have to suffer alone. Headache disorders, especially migraine, are invisible to most, as you have already heard this morning. They force people into dark rooms, they miss work, school, and major life events. They are often misunderstood even by loved ones, those that are closest to them, or healthcare providers. Part of my role is to give their pain a name, validate their experience, and walk with them towards a personalized and evidence-based treatment plan. I don't dictate what care should look like for my patients. I listen. Every patient brings their own goals, beliefs, and values. We have an array of tools now, from medications to supplements, neuromodulation, complementary and alternative therapeutics that can all be utilized to help improve quality of life and align with patient goals and their beliefs. Yet we still face so many barriers. Insurance companies too often deny treatments recommended by specialists. We need policies rooted in patient outcomes, not profit margins. We still lack real-world data that reflects the diversity of the patients we treat. Research must evolve to match the lived experience of the patients with the headache disorders. Education is critical. Most medical schools only offer a few hours of headache education. I've had the honor of directing the headache fellowship programs at both Dartmouth-Hitchcock and now at Atrium Health Wake Forest Baptist in North Carolina. I've trained 15 headache fellows over the last 10 years, but there's still fewer than 900 headache specialists to address all the patients that are suffering. Over 47 million Americans. This imbalance must change. Stigma remains one of our greatest challenges. I think you've heard this already. It happens in emergency rooms, in workplaces, and even within our medical community. Migraine's dismissed often as just a headache, but it's so much more. It's a complex neurologic condition with many phases and symptoms. Individuals experience this uniquely. These problems can include problems with their speech, with focus, with visual disturbances, in addition to the classically described nausea, vomiting, light and sound sensitivity that you've heard about. This is why I advocate, both with Headache on the Hill and as a board member of the Alliance of Headache Disorders Advocacy. I work alongside others to reduce stigma, expand research funding, improve access to care, especially for veterans and underserved communities. Today, I ask of each of you to take action. 1 in 4 households has someone that is suffering with a headache disorder. Be compassionate. Don't make assumptions. Sometimes the best support we can offer is a quiet, dark space for someone to escape for a few moments. And not questioning the coworker that needs to step away for a few minutes, and not judging them to be lazy or inadequate. Together, we can break the silence, end the stigma, and improve lives. Thank you all for gathering today.
Thank you, Dr. Nye. It's now my pleasure to welcome Billy Dwyer to the stage. Billy is the Senior Legislative Assistant to Congresswoman Robin Kelly from Illinois and is no stranger to the headache advocacy community. Billy's career in advocacy started at our Headache on the Hill Advocacy Day many years ago, and through the years, Billy has remained a friend and advocate to our community. Please join me in welcoming Billy.
Good morning, everyone. Thank you all for being here. Like Julianne said, big thank you for inviting me out here today to speak about my story. It's a slightly different than the ones we've heard earlier today, but I'm just a proud advocate during National Migraine and Headache Awareness Month. I come here as a brother, a migraine and headache advocate, and now a congressional staffer. Right behind me, you may see the Capitol. I did the nice 15-minute walk or so from Rayburn House Office Building earlier this morning to be with you all today. But my understanding about the debilitating nature of migraine and headache disorders really shifted for me 12 years ago this week. My sister Melissa died by suicide on June 7th, 2013. It was just about a week or two after I graduated high school. And I was really, folks now think I'm this empathetic advocate and, was a great brother and all of that. But at the time, it was hard for me when I was young to really understand the full weight of headache disorders. And my sister struggled with migraine and other related health complications. And I watched as her energetic, spontaneous, and I will say sometimes annoying. She is, my older sister after all, young woman, turned into really a shell of her former self. I watched as she had to quit jobs, leave university, and lose friendships and relationships, and really was stuck, left in her dark room, struggling to find even momentary relief and, medication that works. And like we've talked about, I think in the last decade, the last 12 years since her death, we've really seen vast improvements and vast kind of opportunities happening, both thanks due to the advocacy of everyone here and everyone who attends Headache on the Hill, but also just the doctors and healthcare professionals. We're starting to see some additional breakthroughs here. But while she was still alive, most of those times were just spent in her room, going from urgent care to hospital to specialist, just really hoping to find treatment. And unfortunately, she was never able to find that relief. And I was still just a kid when I was processing my sister's death and the grief that came alongside with that. But I felt like I had a responsibility to share my sister's story and really just ensure that I could talk about the pain and the experience and the impact it had on our family, dealing with, my mom is the caregiver, my sister is the patient, and my sister Erin and I as, siblings to someone who struggled with chronic migraine. And I didn't have a clue what I wanted to do in college or for a career at that point, but I just felt like sharing my sister's story, talking about suicide prevention, talking about mental health, talking about migraine and headache disorders, really just, I felt a purpose, and it sort of inspired me. And so I followed that, and I decided to get my degrees in social work. And it was actually in my junior year of my undergraduate program where my professor at the time said, you can be the best clinician in the whole world. No offense if there are therapists here. And you'll help your clients very deeply, whether it's 50, 200, 500, depending on your caseload. But if we really want to make a difference, we need people like you to run for office, to serve as executive directors, to be on boards, to write legislation, to be advocates, and that really just struck a chord with me. I call it a light bulb moment. So from that point on, I was really inspired to try to get involved somewhere in public policy and in that sector, and I didn't know exactly how I would do it. Fast forward to my master's, I got my master's in social work, but it was more focused on public policy and nonprofit administration. Still at that point had no time what I wanted to do post school, and I attended Headache on the Hill in 2018, and I came with hundreds of other advocates, and we studied our talking points and got our asks ready and learned our way around the Capitol complex. And I came with a group of folks from Illinois. You probably know many of them, Bob Wald and Melissa Garrity and other folks. And we came here and we asked and we talked to members of Congress. And I actually visited my now boss's office, Congresswoman Robin Kelly. But that was my first real experience with advocacy, coming to Capitol Hill, learning, how can we make a difference? How can we let our voices be heard? And that really moved me. And so then at that point I knew, okay, maybe this is something I'd like to do. This is what I'm, kind of ready for. This is what I'm hoping to do. And now I'm on the other side of the table, which is funny. And it's been a long road to get here. I've been with my boss over 6.5 years. I'm originally from her district in the south suburbs of Illinois. I started in one of our district offices and I came to Capitol Hill. I always say at the best time during August 2020 in the middle of a pandemic. So that was a fun time to move across the country. But but I get to meet with advocates like you all. I've had the pleasure of, speaking at Lunch and Learns for HDA and taking those meetings for Headache on the Hill. And it's just such a thrill to see how it's grown and seeing this installation. I mean, I was getting teary-eyed when I saw it for the first time this morning, just thinking like this community has grown so much. And my sister didn't have, the best community, and shortly before she died, she was connecting with folks through Facebook groups and things like that. But I just know she'd be so proud of seeing you all here today and the installation of the flags. And also, I want to flag Congresswoman Kelly and her role as the CBC Health Brain Trust Chair. Today actually released what she calls a broadsheet, and it's a quarterly health publication that we share with stakeholders and other advocates in the space. And for this month, for the summer edition, she actually chose to highlight gun violence prevention, which is a huge issue in our community and a big priority for hers, as well as headache disorders. And so Julianne was nice enough to submit a piece for it, and we had a great article for her. And then I also detailed my story, hopefully a little more concisely in the written format, but I'd be happy to share it with you all. And yeah, again, I'm just so thankful to have the privilege to be here. It's I'm just a staffer. Usually I'm behind the scenes and behind, taking photos of my boss when she's doing press conferences. But it's such an honor to come here and share my story and my sister's story and just continue to keep her memory alive. So thank you.
I'm always so moved to hear Billy speak. Thank you. And I'm just so grateful to still have you in our community. Next up is Michael Sayer, a passionate advocate living with cluster headache, often referred to as suicide headache because of the excruciating pain and its devastating toll. He's here today to talk about the urgent need for awareness, compassion, and access to care for those living with this rare but incredibly severe disease. Please join me in welcoming Michael Sayer.
Thank you. Today, I'm almost 20 years into having cluster headaches, and I am fortunately relatively well managed these days. But it wasn't always that way, and I didn't always know what a cluster headache was. When I first started to experience them as an undergraduate, I had no name for what was happening to me. I had no idea what was going on. I thought I had some kind of very severe sinus infection with the pain directly behind my left eye. The pain is always in the same spot, always starts the same way. And for multiple years, I had no name for what was happening. I had to try and explain it to professors, classmates, friends, why I was trying to learn through one squinted eye with usually tearing up or a runny nose, trying to do my best to sit still, whereas I think other migraines, you want to sit still in a dark room with cluster headaches. It's almost the opposite. You cannot sit still. It's hard to process anything. And as I continued with them, I kind of understood what I was in for. I knew most of the over-the-counter painkillers were completely ineffective. And it took until one day when a friend of mine was beginning her journey to become a pharmacist, had essentially the headache day in class and told me to look up cluster headaches, and reading that, finding Cluster Busters right away, that incredible community of advocates and patients in the what I learned there. And it was shocking in some ways to read this and to have it accurately and specifically describe the pain I was feeling, what I was dealing with. It shocked me, and the impact that had on me and continues to have on me, knowing that there's other folks out there and that I'm not alone. These flags really speak to that. It has been incredible starting to work with the Alliance for Headache Disorders Advocacy to volunteer and advocate for folks in my position. It took a few years after getting a name for what I was experiencing to get a diagnosis, and then another 10 years to get a treatment plan that worked. What I had available to me either didn't work or made me terribly nauseous, or I could never get enough of a triptan for as many headaches as I had. I've had 3 or 4 a week, and I'd only get 9 pills a month, and I had to ration them. I had to do my best to guess. I only have about 5-10 minutes when I feel one coming on to decide if I'm going to take something or not, and they aren't always as bad as they could be. Making that decision, having that anxiety, having to explain that then to employers. I've been fortunate to have employers who have been accommodating, but I know that's never a guarantee, and I know I could never really be sure just how long that would last if my headaches became a problem for them. I would also have them in the middle of the night. I would go to bed not knowing if I would be waking up in 2 or 3 hours with excruciating pain, knowing I'd be up for another 3 hours until it subsided to the point where I could sleep again. And just kind of see, I would always describe it to friends and family that as bad as it is, I do know it will end, in a kind of that kind of hope at the end of the tunnel made a huge difference, because I don't know what I would have done if I didn't know that. That has always been an extraordinarily challenging part of the experience, and I do really want to thank my wife for finally encouraging me to go out and seek better treatment after having poor experiences in the past with things that didn't work. It was her encouragement and the birth of our child that really got me to try again, and through that I've managed to get pretty well taken care of, but I know they still can come back at any time. And because I feel I'm in a position now to help more, I've really enjoyed volunteering and meeting other advocates, and really driving home just how I am not alone, and I can do something to help the next generation and the folks today who are still suffering with these conditions. To get at better access to care through with the Headache Act, we can definitely work towards more research, better diagnosis, quicker diagnosis, better treatment options, fewer side effects, better awareness and accommodations for those who suffer with migraine and headache disorders. And there really is a better future out there if we get this bill passed. And I do really want to thank the Congresswoman for championing this, and I look forward to working to having more folks sign on and support it and getting it across the line. So thank you very much.
So when we started meeting with bipartisan congressional offices on March 18th, the date of Headache on the Hill this year here in Washington, D.C., one of the first Democratic offices we met with was Congresswoman Lori Trahan. She proudly represents Massachusetts' 3rd Congressional District, made up of 35 cities and towns, including her hometown of Lowell. Within a week of our initial meeting, Congresswoman Trahan offered to be our Democratic lead in the House, and we are very happy and proud that she stepped up. Representative Trahan is a working mother, a former congressional aide who rose to chief of staff in her office. She has also excelled as a technology company executive who later formed a woman-owned consulting firm. I would like to publicly thank Congresswoman Trahan and her staff for their leadership and support, their quick support of this legislation. I just want to read, Congresswoman Trahan couldn't make it today. There's lots of committee hearings happening right now, but she did send a quick statement that I'd like to read. Congresswoman Trahan said, "Headache disorders affect nearly 45 million people in the United States, including more than 117,000 people in the district I represent. Behind each of those numbers is a student falling behind in school, a parent fighting to stay employed, or a veteran enduring chronic, debilitating pain. I am proud to lead the introduction of the Headache Act, a much-needed step forward towards expanding care, advancing research, and raising awareness for this often overlooked condition. Together, we can ensure that no one is left behind simply because their pain is invisible." Now it is my distinct honor to introduce acclaimed actress, producer, and singer, Bellamy Young. Bellamy Young, best known for her role as First Lady Millie Grant on the ABC series Scandal, a performance that earned her the Critics' Choice Television Award for Best Supporting Actress in a Drama Series. Beyond her impressive acting career, Bellamy is a dedicated migraine advocate and patient. She has openly shared her personal journey with migraine, helping to destigmatize the condition and bring awareness to the millions affected by it. Please join me in welcoming Bellamy Young.
Hello, everybody. I'm so happy to be here with you today for this breathtaking and meaningful installation and activation. And hello to everybody that's joining us via live stream. I'm glad you're here too. I think everybody knows that June is Migraine and Headache Awareness Month, and so I am very grateful to work with everyone at the Alliance for Headache Disorders Advocacy. I'm grateful for the work they are doing and continue to do to bring awareness to the scope of impact that headache disorders have, and also to create the first of its kind Headache Act, which would support research, education, and access to care for the millions of Americans who suffer from headache disorders. I'm one of those Americans. I suffer with migraines and have done my whole adult life. And anyone who suffers with headache disorders or migraines knows that it's a very personal journey. While there are certainly shared symptoms, how your pain presents itself is often very individual. I think of it as each of us having the same palette of colors, maybe even painting the same object, but each of our works of art will be distinctly our own. Like Michael, mine starts in my left eye, like a hot spear. And from there, it takes a sort of cinematic flair. It goes, I know when's coming on when my field of vision starts to narrow, sort of like when a camera pushes in from a master shot to an extreme close-up. My sense of smell becomes quite acute, which means I can get nauseous in an instant from a strong odor, and I get intensely light sensitive. When my journey with migraines started, I would just have to go into a dark room and try to get to sleep. That reboot was the only thing I knew that I could do to get through what was happening to my body. I'd asked my doctor about it, but as I am female, I was told for years it's just period related. It's just something that happens. It took moving to New York after college to find a doctor who finally even had a conversation with me about migraines. Since then, I have tried many medicines, protocols, life hacks, dietary changes. I'd tried anything anybody ever told me to try to get my life back. Because you never know when you're just going to have to give up on the day and reboot yourself. And it gets very hard to be reliable in your job, to be responsible in your relationships, or even to do basic things like buy groceries or drive a car. I found something that works for me a few years ago, and the relief I have felt since then is almost indescribable, but the specter of fear still lives with me daily. This phone case that you see on me right now, you can look at my socials. This case has been on me for years, and I know it's helpful to always know where my phone is, but I have this little case because it has a zipper pocket, and in this zipper pocket, I keep my migraine medication, so it is with me on set, it is with me in the car, it is with me in my house, and I always have it. Like you, I know there's a certain point in that narrowing, and if I can catch my migraine before it goes past it, I can get my life back. And I want that so much for everyone. Over 40 million Americans live with migraine and headache disorders. And that means someone in 1 of 4 households is affected. It's the second leading cause of disability worldwide. And as Dr. Barba said, right now in America, there are only 900 certified headache specialists. And if you think it is too expensive to invest in research or training to alleviate or eradicate this problem, let me also share that migraine alone costs the U.S. economy an estimated $78 billion with a B a year in both indirect and direct costs. So, we are here today to advocate for the creation of a national plan specifically designed to address this problem, a comprehensive approach that promises real, meaningful change. By coming together, we can educate lawmakers, healthcare providers, and those people not personally affected. So speak up. Every time you tell your story, you can open a heart. And once enough hearts are open, progress can be made. I thank you for being here. I thank everybody watching on the live stream too. I thank you for showing up for yourself or for someone that you love, because when we come together and take action, all things are possible. Less suffering, more solutions. With our help, a new chapter in living with headache disorders starts today. Thanks so much.
Wow. Thank you so much, Bellamy, for sharing your journey and being a powerful voice for our community. Now it is my pleasure to introduce Shelby Blondell, a songwriter, singer, speaker from Maryland, and one of our fearless Headache on the Hill advocates. Shelby's determination and resilience are evident in her multifaceted career and her advocacy work. We're so glad to have you today, Shelby.
Thanks for having me. Nothing left to feel. Is it real? Holder riding in the sky. Tears crying. Can I go any farther? Can I take the pain? Can I hold on to hope? But tomorrow's a new day when the sky fades at night. Tomorrow's light will come. Sometimes it just takes a day. Disbelief on repeat. Each wave just crashing with the breeze like treading waters alone. Fighting constant unknowns. Can I go any farther? Can I take the pain? Can I hold on to hope? Tomorrow's a new day when the sky fades at night. Tomorrow's light will come. Sometimes it just takes a day. We all paint the scars that remain to help us to grow to who we are. People may not see, but the truth is it shapes who we are. I can go farther, take the pain, hold on to hope for tomorrow's a new day. Sky fades at night, tomorrow's light will come. Sometimes it just takes a day.
I have goosebumps. Wow. Thank you, Shelby. As we come to a close, I want to thank each of our speakers for lending their voice and truth today to speak out for headache health, and to all of you for showing up in person and online to witness this moment with us. The stories shared today and the ones lining this field are a powerful reminder that awareness alone isn't enough. We need action. So before you leave, for our in-person guests, I invite you to take a walk along the installation to understand the size and scope of the problems our communities face and access to care. And then I want you to take the next step. Go to flagsforheadache.org and head to the Take Action page. In just 2 minutes, you can send a letter to your members of Congress urging them to support the Headache Act. It's fast, it's easy, and it's one of the most meaningful things you can do to push this movement forward. And for those of you who are tuning in online, you can do that too. And while you're on our website, I encourage you to listen to the personal stories. Check out the statistics about headache specifically in your state. And if it's within your means, support our work. Finally, I want to extend our gratitude to our generous donors, committed sponsors, partner organizations, and every volunteer who helped bring this installation to life. Thank you for believing in this work. I want to especially thank Susan Stone and the National Headache Foundation, the American Headache Society, the Headache Cooperative of the Northeast, as well as Pfizer, Lundbeck, Amneal, and AbbVie. Your support made all of the difference. Thank you to our volunteer installation committee, Carla, our 2 Jens, Anna, Nancy, Michaela, Laura, Susan, and Brandy. We did this together. Together, we are making headache and migraine disorders impossible to ignore. And we're just getting started. So stay connected with us all month long as we continue the work to make life better for the 40 million Americans living with migraine and headache disorders. And again, what do we want? More research, more specialists, more treatment options, and more good days ahead. Thank you.